Eudaimonia welcomes you. This is Humaira, and I hope you all are happy, healthy, fit, and fine. We have heard about WBC, RBC, and platelets. We know that these are the three most important blood cells in our body. And although all three play a very important role in our body, today we will be talking exclusively about platelets and platelet counts. So let us get started. Platelets or thrombocytes are small, circular, colorless fragments present in the blood. They circulate around the blood and recognize damaged blood vessels. These then recognize it and bind to it in order to stop the bleeding, that is, by clotting it. So, when platelets are found in the blood, it's in its inactive form and is like small plates. But when there is a damaged blood vessel, it sends out the signal to the platelets. And the platelets, one receives the signal, it travels to the area where the damaged blood vessels are present and it transforms itself into active form. Thus, it reaches out to the blood vessels, binds to it, and it becomes in the shape of an octopus or a spider because it elongates its tentacles, and that is how it leads to the coagulation. So the normal range for platelet count is between 150,000 to 450,000 platelets per microliter of blood. So if there is a platelet count above 450,000, then that condition is called as thrombocytosis. If it is below 150,000, then it is called as thrombopenia. And both these conditions have a lot of risk, and that is why it is important for you to get your blood test done regularly. You can find your platelet counts by doing a complete blood test and see whether it lies in the range or not. So, why are high platelet counts alarming? Why it is a problem? So, I've told you that platelets are responsible for clotting of blood. So, when there is excessive platelet count, that is when the platelet counts are so high, like in the case of thrombocytosis, there is spontaneous blood clotting at your arms and your legs. And if it is left untreated, then it can lead to heart attack and stroke. So, for that reason, there are a lot of procedures that are done, such as platelet pheresis. In this procedure, they remove the blood from your body and separate the platelets from the blood cells, and they transfer back the RPCs into your body. So that is how it lowers the count of platelets in your body. Similarly, thrombopenia is also dangerous when there is less amount of platelet in your body. So in that case, you will have easy bruising. When you get a cut, it will not stop bleeding. You will have bleeding from the nose, GI tract, etc. So again, it is important to look at the factors that can affect it. There are several reasons. There can be an inherited condition. Somebody can have cancer like leukemia or lymphoma. If somebody is going through a cancer treatment like chemotherapy, even at that time the platelet count reduces. People who have kidney dysfunction or infection or any kind of if they are including a lot of alcohol in their diet, they're alcoholic, that also reduces the platelet counts. So we have to make sure that our platelet counts are within the range, because having high or alarmingly low levels can be problematic for us. So what is the role of nutrition in increasing platelet count? So you have to look for foods rich in vitamin B12 like animal sources, eggs, meat, there's cheese, etc. You also have to look at iron rich sources. When people have anemia, they're asked to have iron rich foods. So you can have iron, you can have vitamin C because it helps in the absorption of iron. You can also look for foods rich in folate. It is present in kidney beans, in nuts. So you have to include a lot of green leafy vegetables, meat, cheese, then there are nuts, then there are citrus fruits that you can include in your diet. And if diet does not help, then under the prescription of doctor and a professional, you can have supplements like bovine colostrum, then there is melatonin and papaya leaf extract, because these are also known, according to studies, these are known to increase the platelet levels. Now, to reduce the platelet count in the body, foods like cow's milk, tahini, water, Alcohol is also said to reduce, but it is not healthy, so I will not encourage that. In case of water, at least 3 liters of water should be consumed at small intervals because it helps in preventing the aggregation of platelets. It purifies your body, it removes the cleanses the body, removing the impurities from the blood. So you can have a lot of water. Garlic is said to have the compound allicin, which acts as an anticoagulant and a vasodilator. So that is also responsible for reducing the platelet counts in the body in its active form. And in order to be more effective in the body, you can consume it on an empty stomach as well. Pomegranate has polyphenols which has anti-platelet effect. The same case is with turmeric, which also helps in the reduction of platelet count. So what omega-3 rich foods do is they make the platelet cells less sticky, so they don't clamp together. That is how the coagulation is reduced. So you can look for foods rich in omega-3 fatty acids such as walnuts, chia seeds, flax seeds, fatty fish like salmon, tuna, etc. And with this, we come to an end to today's video. I hope this helped you. So it is better to always be aware, be alert, get your routine checkups done, know what is happening in your body, and always watch out for what you're eating. That is all for now. I will see you all next Sunday. Hope you like it. Do share it with people you care about and try to implement on the tips that I give. I will see you all next Sunday. Until then, love, invest, find yourself, and enjoy.